private practice, which I spend most of my time in, but sometimes there's very few walls between my private practice and the hospital, because I see patients that I've seen at the hospital that come and see me for more care, or I send patients to the hospital because I think the programs that Parkwood has developed for patients, the group therapy programs they have, are phenomenal. So I want to thank the team at Parkwood, because it's been 10 years, it's been awesome. It's changed the way I've practiced. I've learned an incredible amount from the Parkwood team, and I have to thank them for their dedication and their strength, their courage to move into non-traditional areas to serve their patients better. In fact, now we have the School of OT, and the students from the PT school come and watch we do a multidisciplinary outpatient clinic sometime, or the students up on the floor when I visit patients in their rooms will come with me. I have neurology residents that follow me. We consult at the bed sometimes. The physiatrists really like it, because the ophthalmology department doesn't do rounds in the hospital. So if they need anything eye-related, one time I had to check to make sure there was no foreign bodies, because they wanted to do an MRI on a patient, and they weren't sure. There was a question, a history, so I had to check that. So, I mean, for me, I get to do some general optometry as well there, but I also get to work on the floor. So I work upstairs on the floors of spinal cord and stroke, ABI, complex care, and then we do an outpatient clinic once a month as well. So the team, there's Shannon. The team is very collaborative. We talk, we watch the patients together, we do some tests. They work back and forth with me, so it's great. And the team is, oftentimes it's a physiatrist that wants me to see the patient, and I'll go talk to the team first. What do you think this is going on with the patient? And they're like, I don't know, but it's visual. And I mean, sometimes that's great. That's like important that they've recognized that, there's something really visual going on. We need the oak prisms, or we need you to go work your magic with the magic glasses. So, and they're an awesome team. We've had a lot of media exposure. A lot of patients, they create patient groups after they've been there, because some of it is group therapy. The irony, of course, is the more awareness there is in head injury and neurodegenerative diseases, the more patients are seeking care, and there's less and less funding all the time. So what they did is they created some really great programs that are group therapy. And they're one of them is called Brain X90. It's an outpatient program. It's a group therapy program, which I was able to give some hints for some vision part of it. And last year they were nominated for a Pillar Award in Innovation, and the Pillar Awards are nonprofit awards in different areas. So I mean, it's nice to see that their innovations have been recognized in the community. So the objectives here, let's go over the neuroprocessing disorders. We're going to talk about Alzheimer's or dementia with Alzheimer's specifically. We're going to talk about Parkinson's. We're going to talk about MS. And, I'm going to just really quickly go through. I finally got to hear Dr. Zielinski speak live, although I've read a lot of stuff from her 3 weeks ago, so I kind of redid half of this. So we're not going to redo Dr. Zielinski today, but I do want to remind everyone about the model that she has created. I think works really well, and it really created an excitement inside of me. So we're going to do Skeffington 2.0. I want you to think of symptom combinations. It's called the Big Six. It's something that I promote to other ODs as a way of regular ODs, recognizing some of the things that you're going to see with neuro populations. And then I'm going to go through a whole pile of testing and treatment suggestions. So, thank you for all the people that helped me along the way, and this is like a very small group of people on there, but there's a huge number of people I could have written on there, some patients, but particularly I want to mention Vicki Mondragon. She is my vision therapist, and she's an optometrist from Colombia who, her and her husband had to flee the country about 15 years ago, and she came to Canada. She doesn't practice optometry, but she's my vision therapist, and she did behavioral optometry in Colombia. So I had to do a lot of work to catch up with her, and she's been awesome. And without Vicki, I think I couldn't be the person I am and produce the kind of service that we have in our office. I want to just remind you that the prevalence of neurological conditions, if you add Alzheimer's and Parkinson's and MS together, particularly in our area for MS, you're looking at 1 in 10 patients, and that's going to increase, okay? And I think that's an underestimate.